Hey, everybody. Today I wanted to talk a little bit about the education I've been finding related to heart disease. I'm going to share my screen here and we're going to go over. Went to a couple conferences the last couple weeks. One was AAOSH, and it's an American Academy of Oral Systemic Health. It's a bunch of passionate dentists. And this conference is now bringing in physicians, radiologists, cardiologists, because their science is good. They're not beholden to anyone, and I trust the sources that they get. Um, let's the I wanted to show a little bit about what I measure and what we do. So here I have two pictures. The one on the right is my carotid artery. The inflammation's not so great. Let's move this around a little bit. And this thin line is inflammation. That's my intima and media. And the measurement is 0.493, the mean average of this little section. Now on the left is another patient, and you can tell that it's twice as thick, this little area. The intima and media is getting a lot of fatty tissue, a lot of fatty cells. It's stressed. It's probably pink and red and puffy. So this is arteriosclerosis that we measure, and I'll give you a number and you can track that. On the bottom, we have our atherosclerosis, which is fatty buildup. Think scars or blisters in the artery, and these consist of soft, fresh, gooey, soft tissues. The LP(a) test is a pretty good one for measuring it and seeing it. We won't look at that video today, but I will put a link on our report. Here's mine. And by measuring the lining, this thin line, the intima and media, on the very tippity top, yep, these two, we measure inflammation. And on the bottom, I will give you a picture of your report. In fact, let me pull one of mine up just so you have an example. This is me. I scan myself a few times a week to not only monitor, but as I'm developing this test and report, I want everyone to see it. On my right bifurcation, you can see that the tissue, the intima and media, is no longer thin and tight. I'm getting some degradation, and the lining's not good. One of the reasons that happens is that there's turbulence. The blue is blood heading up to my brain. The red is retrograde. It's going backwards. There's eddies and turbulence in the stream. And when my diet's not great, when I'm stressed, whatever is causing it in myself, I'm causing atherosclerosis. Arteriosclerosis is the stiffening of the artery. So the lining of the artery, my near wall's not so thin. Let's pull up some pictures of this is a transverse of that plaque. You can see it right there, just getting a little bit thicker. Let's go down and look at the intima media. This lining right here. This is the intima and media of the carotid artery. That layer is throughout your whole body. It's alive. It breathes. It exchanges chemicals with the blood to tell your vessels to open or dilate when you exercise or reproductive reasons. And this is the first casualty of the cardiovascular disease war. On my near wall here in the bifurcation, and let me hold a model up so you know what I'm looking at here. But share for a second. This is a really good model of the artery. This pink layer is the intima and media, and it's throughout, and it coats it throughout your whole body. And every time your heart beats, it pushes blood through 100,000 miles of vessels. And when your vessels are stiffer, it causes your heart that much more work. And a lot of people get enlarged hearts. I had a heartbreaking moment at a conference. In medicine, you just don't get the answers you want. And this nice, not older, but in her 60s lady came up and she said, they told me my heart is enlarged. And that happens when your heart has to push against all that pressure, and the tissues get bigger, and it's no longer muscular and tight. It's just degrading. when the hospital says it's mild, it really is. You're on the board. You definitely have a problem and it's happening. Anyways, it broke my heart to tell her that it does not fix itself. When the heart is starting to enlarge, it causes problems. So this is the artery. I also will tell you where the plaques are and how big they are. So the intima is, I'll give you a measurement on that, and that's the lining right here. And it's this number, 0.518. And that 0.518 is an average of this line. I've got some pictures of it. I think I should have right here in the right common. I should have a measurement of it. Here it is, 0.488. We measure it here on the ultrasound machine. So we have a reference value. And we also measure it with our software on the back end. It's where we measure the plaques and input everything. So your intima is a measure of inflammation. Your plaque is a measure of atherosclerosis. Here's a transverse of my plaque. Let's zoom in a little more. Mine, not really. Let's go back to sharing the screen. Dummy. So here's the story. The lining of your artery, it's there and it's closest to your blood. If there is anything amiss in your blood, diabetes, blood pressure, cholesterol, the science is coming out that the bacteria in your mouth is important. The bacteria in your gut that helps break down your food. This whole symbiotic relationship between you and these organisms is coming to the forefront of medicine, and we're learning more. We can test more. Oral DNA is a wonderful test. But also, what I found at this conference was myocarditis is a serious heart condition. And it's a measure of inflammation, and we're starting to see it in teenagers and kids. And it's only in the last 12 months, 16 months that we starting to see this come out. The researchers I'm following are saying it's becoming an issue, and we certainly don't want it to get worse. So more to come on that information. But for measuring the inflammation in your carotid artery, Vasolabs is your company. We can receive from any ultrasound machine and generate this report. That's today's talk. More research and literature tomorrow. Thank you very much.